Hi, this is Dr. John Runback from American Endovascular and Amputation Prevention. We're talking today about endovascular management of critical limb ischemia, or CLI. I think for the most part, minimally invasive endovascular management in proper hands, certainly experts like we believe ourselves to be, should replace surgical therapy as first-line approach for patients with critical limb ischemia, due to the fact that very often these patients have blockages in the small arteries due to diabetes, chronic kidney disease, hypertension, and poor cholesterol management. Because these blockages involve the small arteries, they're really not very often amenable to surgical bypass. And surgical bypass is associated with much higher rate of complications, longer recovery, and discomfort. Usually using minimally invasive techniques, threading catheters through the arteries to restore flow directly through the arteries to the patient's wound, we're able to prevent amputation in more than 80% of cases, even in patients who've had failure elsewhere.